Hello, everyone. In today's, we are going to discuss about a topic of interest for both of us, and we hope that many of you who are watching will also have interest in what we are going to discuss. Nevertheless, we are going to discuss this topic because we want to. The topic is challenges in conducting meaningful physiotherapy research. And this we will talk especially the challenges faced by Indian physiotherapy research. I want to start this discussion by defining what is meaningful research. What do you think is meaningful research?
I think I should ask you the question rather than me. The other way around. Anyway, I'll just throw some ideas. I think you can. Uh, one of the things I think is there are a lot of definitions for these things, I suppose, or philosophical ideas there. But I think one of the simplest way of looking at it is it should be patient-centric. It should be valuable for the patient, not valuable for the therapist curiosity, if you will, or therapist biases and things like that.
Yeah, that's the fundamental point, isn't it? The patient-centeredness. But I'm not sure. I mean, many might have heard this word, patient-centric. I'm not sure people really get the understanding of what is patient-centric and how this might differ from, as a health professional, what we are interested in. Basically, and also, uh, uh, my understanding of meaningful research is also it falls under the explanation of what you have said, but I would just put that in a different way, that a meaningful research is, the first question is meaningful to whom? That's the
Yeah.
point, that what you have just said. It should be
Mhm.
meaningful to patients, right? Now, that should be, it means that it should be decided by the patients. That's the key, because in a health professional, in a health profession, especially in India, maybe even the same problem is there across the world also, is that the health professionals often think that they know what patient wants. Some of them actually understand, but we have quite a lot of evidence showing that many health professionals doesn't actually understand, or whatever they understand is not in agreement with what patient wants. In a simple term, is that basically, because most people are familiar with ICF, I'll use that example. Basically, whatever falls under activities and participation, especially participation, is what meaningful to patients. What is not much meaningful is changes in impairments. And a physiotherapy point of view, I think defining it this way might help for people to get the hang of what we mean by patient-centeredness. What do you think?
Exactly. If you look into medical research, most of it is what I call as surrogate markers, and surrogate markers are definitely impairments, whether it is some count of some enzyme or blood analysis or things like that, which does not necessarily tell whether the patient is going to live or die. This happened in COVID times also. People were measuring oxygen levels or uh, something like that, partial pressure of oxygen, I suppose. Rather than seeing whether they died or lived or how many days they were in the ICU or did they reduce the stay of hospital as such. So these are the what we mean by meaningful measurements. And even in medicine, as I told you, uh, we are in the era of 60s where biology was the main culprit and surrogate measures are still the norm. If you take stroke, especially in India, people are they have difficulty coming out of three things, I think. One is plasticity, another one is synergy, another one is whether there is a distal activity, proximal activity, all sorts of things, uh, which have nothing to do with whether your patient can earn a living after the stroke or lift an object, go to the toilet or anything. Uh, so I think that is in line with your idea of ICF
Yeah, yeah.
participate.
And just for the clarity, what Mr. Hariom refers to as surrogate measures is also known as biomarkers, because biomarker is a common term, at least in PhD research, and there's also quite a lot of uh, institutes or supervisors insist that you have to have a biomarker as a primary outcome. It's exactly the opposite of patient-centered research. And it doesn't mean that biomarkers doesn't have a value, but their value is different. If you're doing a research, the research should address the outcome. The primary outcome has to be something that is valued by patients. In simple words, most patients expect relief from the symptoms what they are having, whether it is pain or not able to stand. This is what they improve. So having an outcome that improves patients at the basic level or improves their daily activities in a simple way, that should be the primary outcome. It's ironical that many of my conversations with physiotherapists, especially who are doing research, thinks that these outcomes are somewhat, lower value because they are very simple to measure.
I think the problem, I think I see it in a different manner. I think that is because we think in simple terms called as objective and subjective measure.
Yeah, yeah.
And because the biomarkers or surrogate measures are somewhat some sort of objective measure, it makes it more sexy for PhD, I suppose. But it might be an objective measure of what? It's an objective measure of your mission. It is not an objective measure of anything else. The whole idea of having a subjective and objective, especially in a science which is more of a social science, which leans more towards social science rather than I mean hard science like physics, chemistry, or something like that. So to say it is this is subjective and this subjective is just wrong, I think.
Before digressing more in the topic, I just want to make one final point. It's a temptation that whenever there is a chance for me to refer to Jules Rothstein, I have to. So this confusion of subjective and objective measure, anytime this argument comes, I remember the wonderful editorial written by Jules Rothstein, where he clearly says that it is the validity of a measurement that matters. It is not about whether it's subjective or objective. You can have a good, valid subjective measure, and you can have a poor validity objective measure, right? So it's about accuracy and validity. It's not about whether it's subjective or objective.
And also, anyway, the observer, the measurer, has its own. He has his own properties. So let's screw it off. Even beyond the validity point of it, I think I understand the validity comes from the construction of the scale itself. I'm just saying that even if it is not a extremely valid measure I don't know how to say it properly. The more important thing is there should be some value to you as
the construct
well as
of measurement that we are saying, isn't it?
Correct,
that is the
correct.
disability or the participation is the construct of measurement that patients are interested in.
Correct. It's not about this or that and things like that. And we have this sentence, I think you and I also have written this. This is a valid and a reliable scale without I think that's again a ritual of writing it rather than knowing what it means and what the inherent value that that outcome gives in terms of for the patient as well as the overall science of it.
Right. So let me summarize what we have discussed so far. We are discussing about what makes a research meaningful. The fundamental aspect that makes the research meaningful is how much the outcome of the research, to what extent it has a direct benefit to what patient wants to improve. That's where it is, and it is the patients who decides what's meaningful to them. And a simpler way of looking at it is because we have huge amount of research suggests that participation in daily activities from a physiotherapy point of view is the primary outcome patients are interested in. And for to those who thinks that these are all subject to opinions of us, I just want to point out that the FDA in US that insists that any RCTs conducted on drug trials, a patient-reported outcome measure should be the primary outcome. It's a guideline from them, and we will get there probably 25 years later. So it is not a personal opinion. It is now a mandate for everyone. Even drug trials have to have a PROM, patient report outcome measure, as a primary outcome. You can have biomarkers as secondary outcome. That's all right. But any drug has to show that it improves in simple ways patient symptoms or patients' daily activities.
The next point I want to emphasize is what am I comparing the intervention against, right?
Okay.
So if you are saying that I want to compare ultrasound and TENS or something like that, and they have never done this, and I am also keeping a patient-centric outcome, is it valuable?
Right.
So the biggest problem, I think, is this is what I mean by doing research for ourselves rather than for our patients.
Yeah.
Because the outcome of this does not make anybody happy, just the people who are producing TENS and IFT machine, I suppose. Other than that, nobody is wiser than that. So
yeah, this is to be specifically about a meaningful clinical trial. One part of a common research that is being done. Yeah, so there's another aspect of what is meaningful to them is patients who are already receiving a standard care. Or sometimes it is also referred to as traditional treatment, conventional care, different terms. So it is important that anyone who conducts a clinical trial, that they compare any new treatment or a modified version of a current treatment. The comparison group has to be the standard care. Because if you look from a patient perspective, that if I'm a patient, I'm interested in any treatment that can give more benefit than what I am currently receiving.
right.
That's how, as a patient, I look at. I'm already getting this treatment. So I'm interested,
Right.
is there any other treatment that can give you higher benefit? In clinical trials, this is what is referred to as superiority trials, where any treatment has to establish that they are superior to standard care. This is
Right.
what patients are interested in. And this is, again, another characteristic of a meaningful research. But this is where, again, a lot of confusion and myths exist. I know that there are many ethical committees even insist that you have to have a no treatment group as a control group. It is totally opposite to what a meaningful research is. And the reason is they're confusing with a drug trials and drug trials that are at the phase 2 and phase 3. not phase 4 trials, which is
Yes.
coming to now. When you're coming up with a standard drug, you need to establish that it doesn't do any harm, or it actually has certain physiological effects for it to produce, right? So where they compare with a no treatment and see that it has a certain physiological effects more than our body's natural recovery process. So it is basically what we call, the smell test, that it has some uh, 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 something is there for it to even consider that as a treat. This is different phases. But what
That's
we
what
miss,
they, I
yeah,
think that's what they did for during the COVID times, right?
yeah,
They
plausibility
were,
test, basically. That, but using the same idea to physiotherapy, right?
no,
This is
even
the
in
problem.
even in medicine you can't do that, because if you're testing a new antibiotic, it should be superior to the already existing antibiotic, not to no antibiotic in a
Yeah,
sense.
but only when that trial is done where people can think of recommending it. Now, phase
Right.
1 and phase 2 is drug done by a particular drug company for them to go through this process, because you cannot subject any sort of drug that doesn't even have a biological plausibility. Say, for example, in phase 2 or phase 3, you have human volunteers and other people. So for an ethical reason, they go through this, right? So but when eventually it can be recommended, you still need a clinical trial that has to be compared with a newer drug, or compared with the older drug, and then say that it's better, either in terms of cost or effectiveness, or if you're lucky, both, right? But the problem is, without understanding the conceptual basis of a control group, either from a research point of view or from a actual patient point of view, right? Because this is one common question has been asked by many who comes for kind of advice to
Consultation.
me,
Mhm.
that I have to have a no treatment group because people are saying so. In physiotherapy, which is conducted in an academic setting, no clinical trial can ethically afford to have a no treatment group.
Uh, 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 and also, if they're already coming to your clinic, and that's how people are recruiting,
Yeah.
I suppose. You say that from tomorrow you're not getting any treatment. How does it work? I
Yeah.
don't know how does it work, right? So that is one of the other issues I have noted, where people are comparing based on their whims and fancies,
Yes. Yeah.
rather than any value attributed to that. Whether this stretching is better and that stretching is better, all these things does not make any sense, because nobody comes to stretching for as a treatment to you. They come for treatment for say neck pain or back pain. They don't come for stretching for just as that as the treatment, whether it is for IFT or TENS also. Nobody comes for TENS for treatment. They come for relief for a global condition which has so many symptoms or so many disabilities and participation restrictions.
There's another irony. Even if we go with, you have to compare a standard care with a new treatment. The irony is that when the standard care is not evidence-based, what would you do? Say, for example, when you have a clear evidence showing that stretching is not working, and if someone wants to do a clinical trial where they give standard care stretching, now this puts at a difficult position, right? So this makes us far more problems, even if you
Right.
go with that,
I didn't
isn't
get
it?
it. I didn't see it from that point. But I completely understand, because if you say that the standard care for stroke is passive movements for 15 minutes and stretching for 15 minutes and
Yeah,
weight bearing exercise, that means you're already using one of the useless treatment. So you're comparing basically with no treatment, I suppose. Um, so that's where the planning of the study is
yeah,
vital, I suppose. Where you already understand who is the first first rank student so that you can compare with
Right,
him
right.
whether I'm getting better than the first rank student, rather than comparing yourself with the last rank student or something like that, and saying that I got uh, better than him. It means that you are who are the penultimate rather than the last. That's what it proves. It does not prove you're better than the first one. Uh, so I think I don't see it like that. So I think we need to know what is the best standard care, I suppose.
Yeah. Fine. I think with that, we can end today's discussion. What we
Yeah,
have tried to establish today is what is a meaningful research, right? So there are,
just some few points, I suppose. It
yeah,
doesn't cover everything.
yeah, yeah, the major aspects of it. There are more. Again, if you're interested, you can put that in comments. If you think that there are other things also makes the research meaningful, because this discussion is not meant to be a comprehensive list of what all, but it is about to give a sort of eye opener into even thinking that I want to do research. From a question of I want to do research to, if we are asking to, okay, not just any research, uh, uh, you know, meaningful research, right? Don't just do it right, sort of what I've heard somewhere in some Cochrane organization has that as their tagline. So we try to put across what we think is a meaningful research and why it is important to conduct meaningful research. In future, we are interested to explore this topic more to understand what prevents us from doing meaningful research. Now, us here, it's not just Indian physios or Indian healthcare profession. This is a universal problem because we have a tendency to think that only we are doing worse. But if you look at most research, look across that there is a, and more than 80% of research is not really meaningful. That's the bigger problem.
I think they have identified 95% of it is
Yeah, yeah,
research based. So it means
yeah.
that it's supposed to
It
be
is.
in all
It's,
parts of it.
yeah, it's a universal problem, but we will be discussing more about the challenges that are faced by Indian physiotherapy researchers in the future videos. So we look forward to hear from your comments. We'll meet again soon, discussing more about how to conduct meaningful research.
Bye bye.
Bye-bye.